Hey everyone, and welcome to Chef AJ Live. I'm your host, Chef AJ, and this is where I introduce you to amazing people like you who are doing great things in the world that I think you should know about. Before I introduce today's esteemed guest, I want to tell everyone that tomorrow, which is Friday, April 22nd at 9 a.m. Pacific time on the PCRM Exam Room Podcast channel, that's a YouTube channel like this one, I'll be doing a cooking demo with recipes from my new book. I hope you'll be able to watch it. And I want to thank Karen and Gary for sending me this hat. I love it. Thank you so much. You know, I believe that a family that eats healthy together stays healthy together. And it's really a family affair. So today's guest, I've already had her lovely daughter on, and I'm going to be having her husband on next week. But today, some of you will be meeting for the first time a wonderful plant-based doctor. Her name is Dr. Nitu Bajekal. I think I said it right. Magical Bajekal. Please welcome her to the show.
Thank you, Chef AJ. Such an honor to be here, and I've been a real fan of yours. I've been going to the Holistic Holiday at Sea for about 3 years, speaking on it, and you've always been busy, surrounded by all your fans. But I'm sure next time we're going to have dinner maybe together. So looking forward to that.
Well, if you ask me, you should be speaking on that cruise.
I have.
Well, good. That's perfect then. That's fantastic. Yeah.
Speaker there, yes.
That is so, it's funny because every time a guest is on the show, 99% of my guests are referrals from other guests. They get an email just thanking them for being on the show. And I say, do you know any other great guests? And your daughter said, too, you and your husband, both physicians. It's like a family thing, isn't it? Being healthy, being in helping people, being physicians.
Yeah. It's become more of a family thing. It wasn't always, but I don't know how much time you have. We'll talk about, different aspects, but certainly, yes, we are very much a family now that sort of eat together and think together the same way. So it's really been very lovely over the last few years.
That's fantastic. Well, you've been a doctor for quite a few years.
Yeah, I went to medical school, in 1980. So yes, 42 years ago, met my lovely husband. Well, he was my boyfriend then, at the age of 17, 18. And I specialize in OBGYN in India. Having grown up, I was born a South Indian, grew up in Calcutta. I don't know if you're familiar with India. And then went to the south of India to do my medical school training, where I met Rajiv. And then he trained in orthopedics, and he's a back surgeon. I trained in OBGYN. Just love it, find it just as thrilling as I did 35 years ago. So I've been a OBGYN for about 35 years. And then we moved to the UK, London, about 30 years ago.
Wow. But you weren't always plant-based, were you?
I was born vegetarian, and I must have I've never eaten fish or beef, but I have tasted chicken a few times in my life. My mother was, although I don't know if you know about the caste system in India, but there are some castes that don't tend to eat meat and fish and eggs. And so I belonged to that. But my mother was actually not religious. She was an ethical vegetarian who then became a vegan. Basically was always very upset when I would come home sometimes and say, oh, yes, I tasted chicken in somebody's house. And she'd say, why would you do that? So I thought, well, it was already dead, so I ate it. So I must have had a few times. And then, but I was a vegetarian, which meant that I still had dairy. And I moved to the UK, and I watched a couple of programs. By chance, one day I was pregnant with our second daughter, and I thought I'd be a good wife and cook some mince for my husband. I didn't know what it was. And I thought you wash it. And I ended up washing the mince, and I saw the blood running away. And I thought, oh my gosh, that's like period blood. That's like the blood I operate on my patients. So not that I'd eaten mince before, but I just decided I was going to go completely vegetarian again, And a few years later, when my younger daughter was 9, she came home and she said she was going vegan. And I said, why can't you just be vegetarian? And she explained to me that the dairy cows are probably more in pain. And also she said something which resonated very much with me. She said, Mom, don't you realize that white equals red, which basically was white milk becomes red meat after a couple of years because the cows have to be sent to the slaughterhouse. So I then decided, this is 20 years ago, so I didn't know any other vegans than except my brother in the States. And so it was quite a hard journey. And then Rajiv joined us about 5 years ago. He turned plant-based because he had turned diabetic, and he saw a documentary, Forks Over Knives. And when I came home, he said, oh, I'm joining you, I'm becoming plant-based. I said, what do you mean? What did I say? And he said, no, you didn't say anything. I saw a documentary.
Oh my God. So he had to wait until he got a disease.
He had to wait for 18 years, yes, or 15 years. Long time.
Did you have to cook animal products for him while you?
No, never. He ate vegan at home, but as doctors with very busy lives, we were working 150-hour weeks. He would often have lunch in the canteen, and that would usually be egg sandwich, or he never ate chicken or meat. He gave up meat and chicken at the same time that I stopped eating that occasional chicken when I became vegetarian. So he had stopped that. He was just having eggs and fish and a bit of dairy, but that was enough to tip him in. But I will leave his story for next.
Yeah, I can't. Well, good. Then this was a good, telling me a little bit about him. I'll probably rib him a little bit, but in a kind of way. And it's but that's nice that he didn't say, well, you better feed me this stuff, lady.
Oh, no. That's the big advantage of marrying your classmate. You sort of grow together, you're in love. And we always did a little dance. If I was pushing ahead with my career, he would take a step back to be with the kids. And then I would step forward. He would step forward and I would do a little bit. So it's always been very lovely. It's lovely to have a supportive.
And both your daughters remained plant-based or vegan, right?
Yes, and their partners too. In fact, our younger daughter, who's an editor, senior editor for Time magazine, who turned us vegan, not Rohini. Rohini is the older sister by 2.5 years. And Naina's partner got onto the cruise with us, having eaten meat every single day, 3 times a day, got off the cruise and has been vegan since.
That's fantastic.
Yeah, both their partners are plant-based and vegans. So yeah.
Are you able to incorporate this into your practice in any way? Because I think a lot of women that go to a gynecologist or an obstetrician, they're not necessarily going for lifestyle or dietary advice.
So there's not a single patient who sees me, and I see a lot of patients, about 4,000 patients a year. And nobody goes away without having either a seed planted about, lifestyle pillars, lifestyle medicine, and about eating plant-based and why it is so important. Because there's no aspect of women's health that does not benefit from eating more plants, not a single condition. And I know that yesterday, I think you had a women's health program, and they were talking about dementia. And the important thing I want to highlight to you is that in the UK, dementia is the top leading cause of death in women. It accounts for as much as 18%. So over heart disease, over cancer, dementia is now the leading cause of mortality in the UK. Heart disease and cancer are very close second. So all my patients will get advice, they get resources. I have a very active website. I have about 50, 60 different leaflets on various women's health and reproductive health conditions, but also on lifestyle medicine. I have lots of recipes. I cook a lot of oil-free cooking. I teach in community classes because I feel that, it is important that if you are going to talk about lifestyle and about plant-based nutrition, you have to equip people with the right tools. Otherwise, what's the use of me telling them how wonderful it is to eat beans and soy or fruits and vegetables and nuts or whatever, but actually don't tell them how they should be incorporating that. You see, so they have to have practical information. And that's what we've done in our book, which is actually coming out next week. And there are so many recipes in that we try and empower people to sort of, meet them where they're starting. Not everybody has to go vegan. Not everybody has to become 100% plant-based, but the closer you can move to that, the more benefits you will reap, whether it's with polycystic ovary syndrome or menopause or endometriosis or breast cancer. There's just so much joy to be had when you eat like this.
This is perfect timing if your book's coming out next week. Do you have a copy of it you can show?
Yes, I actually was going to send you a copy. So it's called Living PCOS Free. It is quite a big book. It's a deep dive into, so anybody who has any reproductive health condition will actually benefit from it. And actually men will benefit from it too, because it's divided into 4 parts. And the first part is understanding what polycystic ovary syndrome is. The second part is all about making informed health choices. And I, being a doctor of allopathic medicine, what I want to make very clear is not one or the other. So, you know, if you have a big fibroid uterus, or you have a breast lump, or you've broken your leg, you cannot meditate it away. You've got to, meditation will help you to get the peace and the calm and the breathing, but you need surgery. You may need medication. So it's not that it's one or the other. So I try and explain that with all the lifestyle pillars: stress, sleep, alcohol, smoking, and things. Then, and why it is so important to have a plant-based nutrition. The wonderful Brenda Davis has written our foreword. And then the third part is all about the different symptoms: acne, anxiety, sleep problems, all the things that plague PCOS. And then the last bit, Rohini has written along with me, myth bust. So the whole book has got chapters where we do lots of myth busting, knowing your body, case studies, and we've got recipes as well. We've got about 40 recipes, I think, and lots of affirmations and various lifestyle behavioral changes that you can bring in, because, you know, it's not just, it's easy sometimes to lose weight by any means, but then keeping it off can be a real difficulty for some people. Same way, getting healthy, you might do things for a small amount of time, but if you actually don't understand the science behind why you have to do it, it can be a real challenge for people. They then slide off. So knowing your why and actually having the tools to apply that why, and meeting people where they are starting, rather than suddenly telling people to, you know, go 100%, unless, you know, that's what they want to do, that's fine, I think is the recipe to why my patients really, you know, not having had periods for 2-3 years, then start having their periods in polycystic ovary syndrome. I've had to cancel about 6 hysterectomies that I would have normally done during COVID, because my patients decided to go plant-based during that time. And they said, Dr. Bajekal, our symptoms have gone. You know, do we still need the operation? I said, you made me the happiest person ever. A surgeon saying you don't want to operate is sort of contrary, right? Because I love what I do. So yes, this book is called Living PCOS Free. It's going to be available in the US. And so I hope that anybody who's listening who has any health condition, they will benefit from this.
I think, if I'm not mistaken, I'm looking on Amazon and getting the link so people can buy it. The Kindle might be available right now.
Yes, it might be available right now, but certainly there's a distributor, there's a publisher in the US that will be going out. So sometimes you have to pay for shipping and things, you see, so that will be taken away. Because the other thing is that we didn't put any glossy pictures. I was desperate to put lots of beautiful food pictures and things, but I wanted the book to be affordable and accessible to everybody, you know? So that's really our key thing. So that's why it's all black and white, with the images also in black and white, just because we want everybody to be able to afford it and read it and make a difference to their lives.
Is this your first book, and your first book with your husband?
It's not with my husband. It's with my daughter, Rohini.
Oh, excuse me. Oh, that's even,
Yeah.
That's wonderful.
Yeah, because she herself has the condition of PCOS. And I think if you remember, she had given you a slide presentation where she had shown how she went through acne and what changes she brought in. So I have written academic books, but this is my first book for the public. The next one is going to be on menopause and so on.
Oh, that's fantastic, because we already have a lot of questions about menopause in the chat. Like, for example, Susanna, do you recommend estrogen cream for menopausal and postmenopausal women?
So estrogen cream is to be only used in the standardized form, the body identical HRT or hormone replacement therapy. because obviously in menopause, people have a deficiency of hormones, especially estrogen. And so estrogen is what will help people who are having, women who are having lots of hot flushes or vaginal dryness. So it depends upon what the condition is, whether you need local vaginal estrogen, which is not really HRT, but otherwise estrogen replacement can be in the form of a patch, it can be in the form of a gel, it can be in the form of a tablet. But if you have a uterus, that means if you haven't had a hysterectomy, you can't take estrogen on its own. You have to have progesterone with it. But I have a word of warning here. Please be careful and avoid the so-called natural progesterone creams and the natural estrogen creams. There's nothing like that. And then you'll get doses that can actually give you cancer and things. So what you want to do is always, if you're going to go on HRT, you need to see a doctor who is specialized and who understands how to prescribe it. I myself went through premature ovarian insufficiency, which is a form of early menopause, affects people under the age of 40. And I was really struggling at the age of 38, Chef AJ, really struggling, had hot flushes, all kinds. I thought because I was being bullied, I thought it was stress, even though I was a fully trained OBGYN, I wasn't willing to think because my mother and sister were still having their periods. And so it was a really hard time. And luckily for me, I didn't know where to turn, but luckily for me, 6-8 months later, my daughter turned vegan. And that's when I found big differences when I started eating. But I still didn't put 2 and 2 together. The scientist in me still didn't want to acknowledge that nutrition or lifestyle had anything to do with how I felt. Not until I discovered all the science. And that made me very upset and angry because obviously I wanted to know this information to share with my family, for myself and for my patients. So I had to discover it myself. That's why I'm literally on a mission to make sure that people hear everything that is there, and I bust myths so that people don't get afraid of medications, but they also don't get afraid of applying lifestyle changes.
Great. Well, there's a question from a live viewer about, are there certain foods, specifically vegetables, people should eat to prevent dementia?
For dementia, the more colorful foods you eat, so load color onto your plate. Lots of fruits, lots of vegetables, green leafy vegetables. They help to dilate your blood vessels. Stay clear of the ultra processed foods and the animal derived foods. Bring in a lot of beans and legumes. So beans, peas, lentils, and soya. These are all very, very good especially for people approaching menopause, but it's good for all ages. But it reduces breast cancer. 1 in 8 women in the US will get a diagnosis of breast cancer. 1 in 7 women in the UK will get a diagnosis of breast cancer in their lifetime. Womb cancer, 1 in 36 women will get a diagnosis of womb cancer. Excess body weight is a big risk factor. Alcohol is a big risk factor. So for dementia as well. So you really want to there is no different diet. What I tell everybody, there is no different diet for PCOS or different diet for preventing dementia or preventing menopausal symptoms. It is essentially, you want to be following a lifestyle which keeps alcohol and smoking out, brings in the colorful plants and whole plant foods, and keeps animal foods to a bare minimum or not at all. And you want to be, moving your body, exercising, trying to achieve a healthy body weight, having a community, having lots of friends and laughing and just generally enjoying yourself. These are important things that will help you to, live longer, healthier, rather than just living longer, because the life expectancy now in the UK is 83 years. US for women is also about 82, I think, or 81 years. Men is a little bit less. So, we have all these years to live and we want to live them nicely.
Absolutely. People are asking if your book might be on Audible at some point.
It is not yet planned, but I have a feeling that we will need to do it, because I think Audible books are a great way for people who don't like to read or can't read, or and when they're driving in their car, they might want to listen. So I'm hoping it will be there, but as of now, I'm with a small publisher, so she's got limited resources. So let us see whether we can do that. But yes, that was always one of my wishes.
That would be fabulous. I love listening to books that way. So there's a question from Tiffany, a live viewer, who's asking, what are some natural ways to lower estrogen and what causes ovarian polyps?
So it's not ovarian polyps, it's endometrial polyps or uterine polyps. Uterine polyps, often there is no reason, but when you have excess levels of estrogen, which usually comes from eating, either carrying excess body weight because your body tissues make estrogen, and as a result of that you can have high levels of estrogen, which increase your risk of endometrial polyps, which are like grape-like structures that can be seen in the lining of your womb, making you have heavy periods or bleeding in between. It can also increase your risk of breast cancer. So excess body weight can increase estrogen levels. To reduce the estrogen, and of course animal foods, so dairy, meat, all these contain mammalian estrogen, which is different from plant estrogen. Plant estrogens are found in chickpeas and kidney beans and flaxseed powder. These are all very important. They will lower your mammalian estrogen or your excess estrogen by trapping with the help of excess fiber, trapping the estrogen and excreting it out of your system. So you want to lower your estrogen. Try and focus on eating more whole plant foods and cutting out the animal foods, and try to find a way. Just by eating whole plant foods, you eat nutrient dense, calorie light food. So as a result, you start losing weight. And when you lose weight, your estrogen levels the unwanted estrogen levels will start dropping. You're not going to drop your estrogen levels to such a low extent that your body won't function. It just drops the estrogen that you don't want. And fiber is present only in plants. It's not present in animal foods or in donuts or cakes. So what happens, the fiber is really important to feed the gut bacteria, but it also traps this excess estrogen and prevents it from getting reabsorbed. So I hope was it Tiffany? I hope she's got her answer from what I'm saying. But we discuss all this again. I have all this information on my website as well.
Thank you so much. And there is a question from JM. I have a history of breast cancer, so would you recommend HRT?
And so HRT is to be used very, very, very cautiously in somebody with breast cancer. So that is a discussion that happens. So when I have a patient who has history of breast cancer, it won't be a unilateral decision. It has to be a decision along with the oncologist, with the breast surgeon, and the gynecologist. So that's a very, very tiny proportion of women who can take hormone replacement therapy, formal hormone replacement therapy. Local vaginal estrogen is often prescribed now much more freely because it's not considered it's not considered HRT, and vaginal estrogen helps to keep the vaginal tissues supple. We often say that, when you start getting wrinkles on your face, you lose the wrinkles in your vagina. And so what happens is with the vaginal estrogen, it tends to make the vaginal tissues more supple. So some doctors will be happy to prescribe local vaginal estrogen along with other things to somebody who's having painful sex or vaginal dryness in menopause. But HRT has to be an individualized decision with your doctor, not just somebody recommending on Chef AJ's YouTube channel or listening to Dr. Bajekal. That's important. But on the other hand, soya you can eat in breast cancer. Why? Because it actually works completely differently. It blocks the beta receptors of estrogen and will reduce your risk. And we know that from the Shanghai study that those women who eat soya when they have had a history of breast cancer, they have a lower risk of dying from recurrent breast cancer. So, that is important to know because people are often very scared of eating soy and they need not be. So, having 2 or 3 portions of soy is a good idea as part of a plant-based diet because it's rich in protein, rich in fiber, rich in a lot of vitamins, but also plant estrogens.
Great. Thank you so much. There's a question about fibroids from Sharmila. And is there anything we can eat to shrink fibroids? And have you ever heard of water fasting at the True North Health Center? Because I've heard of people getting rid of fibroids by going there.
So fibroids are benign growths. They're very, very, very common. 1 in 2 women who are from the minority communities in the UK, for example, Asian women, Black women will have fibroids, but it is generally very, very, very common. But fibroids can cause painful periods, heavy periods, infertility, big swellings, pressure on the bladder. And we know that those who eat red meat, drink alcohol, especially beer, if they carry excess weight, they are more prone to have symptomatic fibroids. But if you drink green tea, if you have seaweed and soy and flaxseed powder, you can actually, flax seeds, you can actually reduce your risk of the fibroids, creating trouble. Whether you can completely make them disappear is unlikely. Water fasting is of course good, but there are no randomized trials to confirm that, Chef. And what I would say is that as you become menopausal, if you're not on HRT, those fibroids tend to shrink away or melt away. So they will reduce in size. But yes, green tea, exercise, keeping a healthy body weight, all those things will reduce your risk of fibroids. Red meat and things are not good for that.
Yeah, Kathy says, a naturopathic physician I listened to said a mushroom a day will help prevent breast cancer.
Yes.
Or make it far less likely to occur. Do you agree?
Yes, it's not a question of agreeing. You have to always look at the science. It's really important. And so the science, big studies from China actually showed that just eating a small mushroom, even a button mushroom, not raw, cooked, because you don't want to eat raw mushrooms, you can get poisoning. You want to eat a tiny portion of mushrooms is enough to reduce your risk of getting cancer and from cancer returning. So yes, that is a scientific trial. It's nothing, these are studies that have been done and shown to actually make a difference. There are a few things that reduce breast cancer. Eating mushrooms, eating soy, eating flaxseed powder. Because you don't want to eat the whole flaxseed. The whole flaxseed will just pass through and is like a laxative, while you have to eat flaxseed, you have to mill it or powder it to get the lignans to reduce the breast cancer risk. And of course, alcohol is a class 1 carcinogen. For every glass of alcohol one drinks, you increase your risk of about 12 to 13% of getting breast cancer, especially if you're in the menopausal age group. So alcohol is not your friend. Smoking is not your friend. Mushrooms are your friend. Green tea is your friend to reduce risk of breast cancer. Flaxseed powder, soy, and then being a healthy body weight and exercising regularly. So I hope that is satisfactory for your listener.
Yep. Susanna says she wishes you could be her doctor. I'm guessing you can't do virtual from where you are.
So you don't want me to be your doctor. You just want to read the stuff. I have all the stuff for free on my website. So it's like having a doctor. Empower yourself, know your body. You should be your own doctor to a great extent so that you don't have to rely, or you have to rely only on scientific and reliable sources. So ask your doctor the questions, because any good doctor should answer your questions and actually take you seriously and not dismiss you, because a lot of women find that they get dismissed. And, when they have conditions like polycystic ovary syndrome, they are told, just come back to us when you're trying for a baby. Not everybody wants to have a baby, and not everybody should be waiting until they have a baby. They should sort their lives out before that.
Yeah. So Leah says no raw mushrooms. I love them in my salad.
Raw mushrooms are generally not advised. If you're fine with it and you feel safe, that's okay. But mushrooms are best. It takes very little to cook them, and they're just delicious. One thing you can do to mushrooms, you should be taking a vitamin D supplement or getting sunshine, but actually mushrooms are fungi. And so if you expose them to sunlight between 12 and 3 p.m., they will actually make a lot of vitamin D, and a small cup of mushrooms is enough to give you your vitamin D supply for the day. But it's not a reliable source, just like eggs are not a reliable source of vitamin D. Sunshine is, but you need to, again, it's variable. If you live in the UK, you hardly get that much of sunshine. So you want to make sure that your vitamin D levels are adequate. They're not actually a vitamin. Vitamin D is actually a hormone. And so it's important to know that it's got a lot of effects. It actually has detrimental effects in deficiency in polycystic ovary syndrome, for example.
Yeah, thank you. Okay. There's a question. Is there any correlation between natural childbirth versus C-section and how it affects a woman in menopause?
No, no. Because it doesn't affect your ovaries. It's your ovaries that are affected. So this is important to understand that menopause is when you stop your periods completely and 12 months have gone by. Now you're born with the number of eggs. The day that you're born with all the eggs you're ever going to have. And they are actually probably a third of the number of eggs that you were conceived with. So the eggs tend to get destroyed naturally, very different from a man's sperm that gets regenerated every 72 days. So, so for women, we are born with these hundreds of thousands of eggs, and then they tend to just every month one egg gets selected and the rest get depleted. About 100 eggs will get depleted and get destroyed. So even if you're on the pill, even if you're having have 10 children, it doesn't mean that you'll have more eggs to keep. The number of eggs tend to get slowly depleted, and when they fall below a critical level, that's when menopause occurs. And sometimes menopause occurs, like in my case, under the age of 40. So you may be 15, you may be 20, you may be 25, is known as premature ovarian insufficiency. But the vast majority of women will go through menopause between the ages of 45 and 55 all over the world. They start their periods between age 8 and 16, and between 45 and 55, most people's periods will stop.
I know some women that waited till their 50s to have children. Is that, I mean, does that have any effect on anything when you have children that late in life?
So after the age of, so spontaneous conception is unlikely and not very common after the age of 50. Having said that, there will always be somebody who will be pregnant at the age of 50, but you don't want, your fertility starts decreasing after the age of 37. So, if you are somebody, having a child is really, really important to you, but, you've got a very busy career, busy life, but you want children at some point, you want children, then the sooner you think about things like egg freezing, it's better than leaving it into your 30s or 40s. But on the other hand, if you're quite ambivalent and say, you know what, it's fine if I have children later on, if I meet the right person, I don't want to do anything about it. I know I can adopt. I know I can, maybe I'll get pregnant, maybe I won't. It's not the end of the world for me. In that sort of situation, it's absolutely fine. About 15% of my patients get pregnant in their 40s. So between 40 and 45, it's not that uncommon, but you have to try harder. You may have other medical conditions. So, if it's really that important for you and you've found the right person, or that you can actually go to a clinic and have a pregnancy, then that's absolutely fine. But don't leave it till too late if you think that is really important to you. But it's not important for everybody, and it shouldn't also be. So it's absolutely fine if you don't have any maternal instincts.
Yeah, oh, good. Well, do you find that a lot of these conditions like PCOS have been on the rise lately?
Yes, polycystic ovary syndrome is definitely on the rise, and it's so much so that it should be a public health issue. In the US, you spent about $8 billion on pregnancy complications and diabetic complications from polycystic ovary syndrome. And in spite of that, nobody understands exactly what the condition is. Nobody really does very much about it. 1 in 10 women will suffer from this condition. And actually, if you're from certain minority groups or subgroups, like those who are having fertility issues, if you're carrying excess weight, you're from the Asian background, you may have 1 in 4 of women will actually have the condition. So it is definitely on the rise, partly because even though there's a genetic background to it, lifestyle, sedentary lifestyle, and the foods that we tend to eat tend to make these conditions worse, just like type 2 diabetes. So PCOS is a close cousin of type 2 diabetes, but with much worse symptoms than even type 2 diabetes, because it comes with psychological symptoms, anxiety, depression, sleep disturbances, OCD, all kinds of symptoms, excess hair growth, acne, missed periods, infertility, excess weight. So, it's really important that we focus on it, which is one of the reasons why we decided to write the book, because there's so little light shed on it. And because there's so much stigma associated with it, people do not talk about it. Celebrities don't come out and say, I've had PCOS. And so that is really one of the big reasons why we felt, we do need to start talking about such a common condition that lasts right into menopause. It can increase your risk of heart, cardiovascular problems, type 2 diabetics, women with PCOS, by the time they reach 40, over half of them are diabetic. And endometrial cancer, womb cancer is also a problem. So yeah, definitely it is on the rise.
Well, Carrie Lynn is saying, what books does the doctor recommend? Well, we recommend her book, and we're putting the link in the chat in the show notes.
There's also a lovely book by Dr. Neil Barnard called The Body in Balance. There are some, depends on when she means what kind of book. Is it on women's health?
Well, she just said, what kind of book do you recommend? Maybe she tuned in late and doesn't know that you have a brand new book.
Oh, okay. I shall show it. Living PCOS Free. And it's written with my daughter, and it's really, really interesting because it's got lots of case studies, lots of myth busting, lots of pointers and recipes, and lots of lifestyle help along with medications as well.
Wow, that looks great. I can't wait till it's on Audible.
Yes.
So listen to it. There's a question, if the 12% of breast cancer increase from drinking alcohol, does that only apply to women?
Men also get breast cancer, but men get other types of cancer. But alcohol is a class 1 carcinogen, which means it's known to cause cancer without any doubt. And prostate cancer and breast cancer being very closely linked together, and we know dairy increases the risk, for example, of prostate cancer. Alcohol also increases the risk of about 7 different cancers, bladder cancer, and various other cancers. So yes, men are also at risk of cancer if they drink alcohol. And we know that for every unit beyond 2 or 3 units, and a unit is a very small amount of alcohol, it's hardly 75 milliliters. So the glasses that most people drink now often will have about 3 units of alcohol in it. And that's already your week's quota. But the best amount of alcohol is no alcohol.
Thank you for saying that, because a lot of doctors don't say that.
And the Royal College of Obs and Gynae has come out very clearly that there is no safe limit for alcohol. Similarly, there's no safe limit for caffeine also in women who are pregnant.
You. I tell people to avoid both, but you know how it is with addictions. So Lissa is saying that she had PCOS surgery 21 years ago, and then 7 years later was diagnosed with diabetes. There's a correlation between those two diseases often.
Yes, because the main driver for PCOS is insulin resistance. So your tissues get resistant to the action of insulin. And so more and more insulin has to be produced. And insulin has a side effect of increasing your androgen levels. So you also are left with acne and excess hair growth and all the other issues as well. So yes, PCOS and type 2 diabetes, metabolic syndrome. In fact, PCOS is a very poor name. The name really makes me upset, actually, because there are really no cysts in the ovaries. Those are just empty egg follicles. What it should really be called, polycystic ovary syndrome, it's an endocrine condition. So it should really be called metabolic reproductive syndrome. But people said it'll confuse people even more. So let's just leave it as PCOS. But it's actually a misnomer. And I've got a whole a fun fact and myth buster in the book talking about it as well.
Great. Thank you so much. This is meant to be a joke, but I have to read it because it's so funny. This is just hilarious. Leah says, well, if I eat 12 button mushrooms, can I have a glass of wine?
So there have been studies to show that if you put a whole lot of green vegetables and broccoli and have a tiny piece of steak, you do mitigate to some extent the harmful effects of the steak. But the harmful effects of the red meat steak is still there. The same thing will apply still to button mushrooms and to alcohol, is that yes, the button mushrooms or the mushrooms will be doing a very good job, but they will have to work against a harder enemy who's trying to push through. So alcohol is, not going to be your friend. But at the end of the day, I would suggest try the non-alcoholic wines, try the non-alcoholic beer, and keep the alcohol or the champagne for the real toasting, when you really want to celebrate something, if that's what, if you really want to. And if you are drinking alcohol every day, then try to drink it every other day, and then slowly reduce it and replace it with sparkling water with some lemon in it, or some non-alcoholic wines or kombucha and things like that, so that you can trick your brain into initially thinking you are having a drink. And it's more the social aspect, isn't it? So you just have to find different ways. And when anybody asks you, because friends often want to derail you when you're trying to be healthy and things like that, so all you say is, today I'm not drinking, today I'm not eating meat, so that you can slowly then make them come around to the idea that actually it's okay to not drink on a particular day.
Thank you so much. Here's another mushroom question. Do they still produce vitamin D if they're exposed to daylight through a window, or do they have to be exposed to direct sunlight?
Direct sunlight. You cannot make vitamin D. And Chef AJ, remember to ask Rajiv the questions on bone health, because he's very good with bone health. But vitamin D, you cannot get through a window. Sitting in a nice sunroom, that sunshine that comes through will make you lovely and warm and give you a lovely, cozy nap. But it does not give you the vitamin D, because the UVB lights cannot come through the glass. So same way, mushrooms have to be in direct sunlight.
Perfect. Thank you. So here is a question, actually, from Nancy. Does the COVID vaccine decrease fertility?
No, no. Vaccines cannot reduce fertility because that's not their mechanism of action. What they have been shown to do is maybe increase your period length by 1 day. So it may delay it by 1 day. That is the maximum that it has been shown to do, because we know this from HPV vaccines that we recommend for preventing cervical cancer and things. They do work on the immune system, but often what happens with COVID, getting COVID, or just being in the pandemic, is the stress levels can be so high because you're scared. We know that 1 in 5 babies born to those who are not vaccinated will be preterm. We know that 1 in 40 women who get infected with Omicron, if they have not been vaccinated in pregnancy or before pregnancy, they can end up in ITU, intensive care. So we do know that all these things can make you much more anxious when you're trying to conceive, and that might have a different effect. But the vaccine itself, no.
Great, thank you. Here's a great question from Anne. After menopause, do we still need to visit our OBGYN? And if so, does it have to be annual?
That's a question mostly for those who are based in the US. In the UK, we don't have a system where we go every year or for any regular checkups. We try and educate the person so they know when to seek help rather than coming for just a yearly check. So if that is a system in the US, then I would say yes, you should, because you may have to have a mammogram every 3 years, a pap smear every 5 years. You may have other medical conditions that need to be looked at. But in the UK, we don't have that system, because we basically work on a system where if it isn't broken, don't try and fix it. So we want to educate people more about healthy lifestyles and things like that. Still not perfect. So mortality rate and morbidity rates haven't really been shown to make that much of a difference. But if you can afford it and you have a good doctor who is not going to just give you push pills onto you, and then definitely go see the doctor, because any screening tests you should keep to, whether you live, whichever part of the world you live in.
Right. Thank you. Cindy says, can you buy a light that you can just sit under that would provide you with vitamin D?
Oh, I don't know that. I just try and use the sunshine. So I will have to look that up online. I don't know. Maybe there is. I'm sure there are clever people who come up with things like that. The important thing about sunshine, one should know, is that if you have pale skin, you should expose your arms and the back of your neck and the back of your legs for about 15 minutes without putting your sunscreen. And then you put your sunscreen, so that, and don't expose your face because that can get burnt. So what you want to do is expose your arms, the back of your legs, the back of your neck, So you get your vitamin D, ideally between 12 and 3. But if you have very sensitive skin, of course, that's not for you. And then you slap on your sunscreen. If you have darker skin like me, or if you have black people with darker skin, you will then find that you want to expose your skin to sunlight. So I would need something like 30 to 45 minutes of sunlight, and then I would put my sunscreen on. So because of course you don't want to omit the sunscreen, because skin cancer is also a problem. So you want to get your vitamin D, but it can't come through those highly protective sunscreens, because they block out the light as well.
Right. Thank you. Allie says, I'm 45 in early menopause. Does this mean my lifespan will be cut shorter? I'm whole food plant-based and exercise regularly. What are my risks?
So we know that if you have become menopausal at 45, that's the normal range. But if you're somebody, as I said, like me, that you became menopausal earlier, yes, you should be taking HRT. And because we do know that those under the age of 40 should be put on hormone replacement, and they should take it at least until the age of 51 or until the normal age of menopause. At 45, it would be a discussion you would have with your doctor depending on your clinical symptoms. But if you're on a whole food plant-based diet, if you're exercising regularly, if you are a healthy body weight, there is no reason to expect that your life expectancy should be any much more shortened, especially given that the vast majority of the world's population is carrying excess weight, is suffering from heart disease and diabetes and other chronic illnesses.
Yeah. So, your husband is going to be on a week from today. Is there something you can tell me that I shouldn't know, that I can impress him by knowing, maybe about him, or something funny? I'm just thinking.
Oh, I'll have to think about that.
Wouldn't it be fun? I could say, well, I don't know. I was just thinking, but I can't wait to meet him.
Tell him that you've heard he's a terrible cook.
Okay.
Because he's now become the main cook. I love cooking, but I have not entered the kitchen for the last 2 years. Since the pandemic, he's completely taken over, so much so that he's redesigned our entire kitchen this last few months. So you can tell him what a terrible cook he is. And you've heard that from, some friends who know, common friends that each other.
Thank you. I'm putting it in my calendar. That's hilarious. Susan says, what do you know about thermography for breast cancer screening instead of radiation from the annual mammogram?
So again, in the US, people have annual mammograms. In the UK, we don't, because there is a risk of radiation. So we do it only every 3 years, unless there's a medical indication. Thermography is coming up, but I don't think that it has to be used in conjunction with ultrasound and things like that. I'm not in the UK, OBGYNs don't deal with the breast. So I don't actually recommend patients have thermography or mammography and things. That is done separately. But as far as I know, it is definitely a useful technique, but is not used on its own.
Got it. Thank you. Colleen says, my daughter had a patch put in her arm so she doesn't get her period. Are there any risks with something like this down the road?
No. So if you're on hormonal contraception, so if you're on the combined contraceptive pill, if you're on the implant, which is what your listener is saying, she's got either a patch or an implant, which can be left in for 3 years, or an injection. These are hormone injections, which are you're not meant to have a period on it, but you have the right hormones in your body. So it's going to have no long-term issues at all. However, for some women, if they are on the implant in their 40s and early 50s, that can cause a little bit of bone thinning when you're in that age group. But for young women, not an issue at all. Similarly, with the combined oral contraceptive pill that we know about, you can take it back to back without a bleed. If you take it for at least 4 years, you halve your risk of womb cancer, colon cancer, and ovarian cancer. If you take it for more than 12 years, you have a slight increased risk of breast cancer. But as soon as you stop taking the pill, that risk goes away. So that's just important to understand, that not having periods is not normal if you're not on hormonal medication. So you have to then look for conditions like PCOS and anorexia or eating disorders, exercising too much. Those sort of conditions can cause you to miss your periods. And of course, if you're approaching menopause or early menopause and things like that.
Right. Thank you. People are saying what a wealth of information you are. So I'm saying buy the book, support her if you love her.
Also, yes, thank you. But also, as I said, my website has so much information on various other topics, topics that people often want to know a little bit more about. So it's just simple. You just put my name in, Nitu Bajekal, and you'll get my website. And that's all you need to do. If you buy my book, that's great. But you know what? The information, I have lots of teaching materials as well. So if you're doctors or nurses or any health professional listening in, you're very welcome to use my slides. I don't have a problem. And Chef AJ, you can actually put the slides that I have sent you. They can be on your feed as well afterwards. I just want knowledge to be out there.
Well, thank you. And if you do that, your little PowerPoint, they'll have the slides right here in this presentation too.
Yes, absolutely.
Your husband can't be that bad of a cook. He must make something you like.
He is a fantastic cook.
Okay, so that was the joke. Good. What kind of cook does he make? And do you guys use an Instant Pot or an air fryer?
Yes, he loves his Instapot. He is a very adventurous cook, actually. He makes all kinds of things, edamame, spaghetti. Oh, his tofu is to die for, his tempeh is to die for. He's very, very good. I'm more of a traditional cook. So I cook a lot of South Indian food and food from Bengal and things like that. But now I only cook when my daughters come home. Our younger daughter lives in New York, and Rohini lives in London, in central London, about half an hour, 20 minutes from us. So when they come home, I tend to cook because, but nowadays they're starting to ask more for daddy's food rather than mine. So, and he cooks it all oil-free, so it's amazing.
That is fantastic. Okay, this is an important question. In what age do you say that we no longer need to get a mammogram or a pap smear?
So after the age of 64 in the UK, we don't recommend that you have a pap smear unless you've got a problem. So if there is a problem detected when you're 60 or 61 or 62, at that stage, you don't go off the system. If you've got there's an issue, then you carry on. But otherwise, unless there's a reason to, at 64, you don't need it because your risk of cervical cancer is virtually zero at that stage. We now do primary HPV testing. So cervical cancer is caused by a virus. And that is important for your listeners to know. It is caused by human papilloma virus. And that virus, actually, there's a vaccine that can prevent 70% of those cancers. And so that's why we advise that if you are a 12-year-old or a 13-year-old, until you're 25, in the UK, we give it free of cost. And after 25, you have to pay. In the US, I suppose you have to pay for your vaccines. I don't know how it works. But here it's all free. So we would recommend that you have smear tests starting at the age of 25 in the UK. And then we do it every 3 years until 50. And then after 50, of course, only if you've been sexually active. If you've never been sexually active, which means no sex toys that are shared, no penis penetration, no sex with anybody, then you should not be having a instrument put into your vagina. That is, not needed at all. You don't need a smear test in that situation. You can't get cervical cancer because cervical cancer is caused by a virus that is transmitted through close sexual contact.
Oh, thank you. Yesterday, we actually had a conversation about sex toys for the first time. So
did you? Yes, very important because especially for women in the menopause, vaginal dryness can be a real issue. So I have a whole fact sheet on how to improve vaginal dryness, the things that one has to use, but also remember that vaginal dilators and vaginal vibrators and things can really make a difference for women.
Great, thank you. Let's see. I saw two more questions. I want to see your slides because they're fantastic. Oh, you have a beautiful smile and beautiful teeth. I think they're talking about you. And I saw something about bone density. The question from Sherry: do you think that a bone density test is necessary for women?
I think if there's a strong family history of osteoporosis, if you're on a standard American or Western diet, yes. And sometimes if you want to know what your bone density is, then it's fine. But just knowing something sometimes can help to spur you on. But I would say anybody listening, don't wait to have a bone density test. Make sure that you're doing strength training or weight resistance training at least twice a week for 30 minutes on top of whatever else you're doing. That's really important. Whether you do some skipping, whether you do jumping on a little trampoline, whether it is lifting weights, These are really important to prevent muscle loss. But again, these questions are best for Rajiv because this is completely his area.
Sounds good. That is great. Oh, Amy says, I've been having hot flashes for 7 years. When will it end?
So most women, 2 to 4 years. If you're 7 years, you're slightly in the unfortunate group. There are about 10% of people who will carry on for about 10, 12 years. So if you are suffering a lot, Dr. Neil Barnard's recommendation based on the randomized trial that he did, where women eat a handful of edamame beans or half a cup of edamame beans, will reduce hot flushes by 84%. And those are severe hot flushes. Moderate to severe hot flushes are reduced by 84%. So definitely you should want to try and incorporate young soya beans, edamame beans into your diet, have some tofu, some tempeh and things like that, really important. But if your quality of life is really not very good, then you should be having a discussion with your doctor about having medically prescribed hormone replacement therapy.
Wow. I'm always cold. So I can't imagine. I can't understand what a hot flash is. It might be welcome because I'm always so cold. That's just so.
No. So the thing with hot flashes is you actually have a hot flash and then you feel terrifically cold. So it can be all kinds of, it's called a hot flash, but it can be night sweats as well. So it's very complex. But yes, probably your diet also helped you because 85% of women have hot flashes. Only 2 or 20% of women will seek help. But also women in the Western hemisphere tend to have much more hot flushes because of the high saturated fat and the diet compared to women, say, in Japan and China. Of course, now the diets there are changing as well, but it's probably to do with the high amounts of plant foods and soy foods in their diet that makes a difference.
That's great. Well, did you want to share your slides if there's a little bit?
Yes.
Because they look great. I saw them.
Sorry, I've got a bit of hay fever, having walked the dogs for 2 hours today. My nose is
2 hours. What kind of dogs do you have?
I've got 2 rescue dogs. So they are very, very cute. One was abandoned in Bosnia. The other one was abandoned on the road, not far from us. And they've been with us for 6 years. Our dog before that was 17 years of age. They're mostly plant-based. So they eat a lot of beans and tofu and sweet potatoes and rice and everything. One likes medjool dates and the other one loves, marinated tofu. So they're real characters.
Nice.
Full of energy as well. My husband walks them for a couple of hours in the morning and I walk them for a couple of hours in the evening. So they
That's
get 4
a lot
hours
of exercise for dogs.
Yes. And one of them is small, but they're still, if I tell them now that we're going for a walk, they'll be at the door in a minute.
They understand that. That's great.
So shall we do the slides, Chef
Please,
AJ?
I'd love to hear your presentation.
Will you let me share my screen? Do you think?
I already did. I poked the button already. Just press share screen on your end. It should work.
Oh, where is it gone?
Just put your presentation up and then the button on the bottom, it's green, usually share screen.
Is it coming up for you?
Not yet.
Okay, so that's not working.
Do you have it on your desktop? Is it on your desktop?
Yeah, it's on my desktop.
I might be able to help you. I have it open. Hold on. Let's see.
Share screen.
I mean, if worse comes to worse, I can do it for you.
Can you do it for me? That would be great. I don't know why it doesn't want to let me share my screen.
Sure. Let me do this. It's a good thing you sent it. Hold on. Okay, now I'm getting nervous, but here we go.
No, don't be.
There we go. Do you see your slides now?
Perfect. Can you press the slideshow now?
Let's see. Press slideshow. Do I have to download it first? Oh my goodness. We didn't practice this, guys. Let's see. I have it just in. Okay, wait. Maybe,
okay, let's do it this way.
Wait, open with Google Slides. Hold on. I think we can do this. I just have to open it. Let's hope that, I don't know what you see right now. Are you seeing it now?
Yes.
Okay, so now we just have to press slideshow.
Slideshow. There's a slideshow here. Okay. Can you see on the right-hand side?
Yes. Oh my goodness. You're amazing.
Fabulous.
You just tell me when to advance it. I'll be your tech guy.
That's fine. So basically, yeah, that's fine. This is the most.
There we go.
Yes. So, the previous slide was just saying what I did. So this is really important.
Here we go. Here we go.
This just says that I was the first lifestyle medicine OBGYN in the UK, board certified from the US, and I'm also an obs and gynae consultant on the NHS and privately for 35 years. I trained in India, and our motto, I run a project for children and for women to empower them. So educate, energize, and empower. That's what I want everybody to feel and be. So next slide, thank you. So I always show this slide because it's so important. Survey after survey has shown that women do not know different parts of their body. 1 in 4 women do not know where their vagina is. 1 in 2 women do not know where their cervix is. So this is a little picture where I show you, this is the outside. So these are the outer lips called the labia majora. This whole area is called the vulva. You should know where your clitoris is. It's just as important as the man's penis. This is the urethra where you pass water. And these are the inner lips, which is labia minora. These can get affected in skin conditions like lichen sclerosis and eczema and infections. You also have this opening, which is the vagina, and then the space between the vagina and the back passage is known as the perineum. You go on, and this is a vaginal tube, a muscular tube. I was telling you about the wrinkles in the vagina. As you become menopausal, these wrinkles go and they move to your face. And so you basically have a little uterus with fallopian tubes with the fimbrial end and ovaries, which are the egg baskets. And an egg gets released most months, travels up the fallopian tube. And if there is a sperm, it meets it, and then there's a baby formed, an embryo, which then gets implanted in the uterus. So this is really important to know your body, because if you don't know your body, you're not going to know when things go wrong, and you're not going to be able to explain that to your physician, and you may not be taken seriously. Next slide. So as I was saying, there is not a single condition in general health or in women's health. And when I say women, I also mean anybody assigned female at birth, anybody who's got female genitalia. So every single condition can be improved by following lifestyle changes and nutrition changes, whether it's autoimmune conditions like lupus, or whether it's PCOS, or whether it's anxiety and depression, or whether it's COVID-19. So next slide, please. Perimenopause is your approach to menopause. So as you're heading into menopause, average age is about 47 years. It's usually a gradual change unless you have a surgical menopause, and it often lasts about 4 years, and the ovaries slowly start to fail. So you start noticing that your periods are jumping about, you're having some regular periods, then you skip a few, they come closer again, you may have menstrual irregularities, and you may need to see a doctor about this. And you may have hot flushes, but actually doing hormone tests at this time is usually not very helpful, because they may be completely normal, and the next day they may be actually showing signs of menopause. Next slide. So perimenopause, or menopause in transition, was you reaching menopause. Once you reach menopause, it is because you've not had periods for more than 12 months, for a whole year. And this is because the ovaries stop releasing the eggs. They're already, you're born with a number of eggs, as I mentioned. The estrogen levels start falling, and as a result, the feedback to your brain results in rising follicular stimulating hormone. FSH levels rise. The average age of menopause all over the world is about 51 years. The range is between 45 and 55. There are at least 34 symptoms, probably even 50 symptoms that have been associated. Tinnitus, you can have dry skin, you can have tingling in your skin, you can have hot flushes, vaginal dryness, urinary incontinence, difficulty in holding your bowels, gut motility issues. I can go on, but hot flashes are the most common. Only 2 or 3 out of 10 women will seek help, even though 8 out of 10 women actually suffer from hot flushes. Next. So now we'll just move on to another condition. This is an estrogen-dependent condition, endometriosis. Endometriosis condition is also increasing in the modern age. Tissue that is similar to the lining of the womb. So every month this lining gets shed because a pregnancy doesn't occur. But in some women, it sticks itself on the ovaries, on the back of the womb, and can cause scarring and pain and painful periods and painful sex and difficulty in having pregnancies or getting pregnant. Later on, some women are at an increased risk of getting ovarian cancer. 1 in 10 it occurs, but many remain undiagnosed until they've trying for a baby or because they've gone repeatedly to the doctor. It takes about 8 years to diagnose endometriosis because the only way to diagnose endometriosis is usually through a laparoscopy. So you have to see a specialist like myself, a keyhole surgeon, who would then do this procedure to diagnose the condition and treat it. It can cause chronic pelvic pain and it's really quite debilitating. I remember a patient telling me once that, it's a fate as bad as cancer. Everybody empathizes with you when you have cancer, but when you have endometriosis, because you look normal from outside and you're having so much of pain, nobody really understands what you're going through. Next slide. We've talked quite a bit about PCOS, and do buy my book. Even if you actually don't have the condition, there's so much of information that can help you with any women's health condition. It is not a condition that is a disease of the ovaries. It's actually an endocrine or a hormone disorder that affects the way ovaries functions. The ovaries are normal actually, and it can be affecting 1 in 4 people, but 3 out of 4 women will never get a diagnosis of PCOS. It's that uncommonly diagnosed, and insulin resistance is the main driver in about 3/4 of cases, and a lot of women will also be carrying excess body weight, but genetics plays a role. And so when you have genetics in that setting, then the presence of insulin resistance and excess body weight will trigger the whole condition. Next slide. So did we miss a slide? No, maybe not. So there are 6.
This is the last slide.
Yeah, that's fine. Next one, yeah. So whether you are approaching menopause, whether you're in menopause, whether you are a young person, whether you have endometriosis, whatever it is, there are 6 pillars of lifestyle medicine for everybody to follow. And that involves trying to eat as many whole plant foods as possible, moving your body regularly, trying to do some structured exercise, restorative sleep. So trying really hard to get 7 to 8 hours of sleep, especially that can get disturbed in polycystic ovary syndrome, or if you're in pain or in menopause, learning to recognize your stress triggers and managing them. So, it's not that we all don't have stress. We do have stress, but finding ways of managing them can really make a difference. Really trying to be mindful about drinking alcohol and avoiding smoking is really, can make your symptoms much worse. And remembering that having friends, having a good laugh, being close to your family, all these things are really important and form one of the pillars of lifestyle medicine. And this is the American College of Lifestyle Medicine leaflet, which is really good and again explains all the 6 pillars of lifestyle medicine. You can see at the bottom of the slide, each slide, my Instagram handle, Dr. Nitu Bajekal, and also my website. So that's there on every slide, just so that people know. And whether it's PCOS, especially for PCOS, all 6 pillars of lifestyle are key. Weight loss and behavioral changes only come when you're not focusing on weight loss. If you actually say, I'm going to be healthier, I want to play with my grandchildren, I want to travel, I want to have a baby, whatever, those sort of goals tend to be better and help you to lose weight rather than focusing only on weight loss. Because when you do that, you get obsessed and then you're standing on the scales and you're seeing things don't shift. So you're much better off choosing healthy lifestyle goals rather than just using weight loss. Would you agree with that, Chef AJ?
Absolutely.
Yeah. And the other important thing that people don't realize is that polycystic ovary syndrome is associated with a lot of long-term effects, high risk of type 2 diabetes, womb cancer, gestational diabetes in pregnancy, cardiovascular disease. So, there are a lot of reasons why you want to take your health into your hands as soon as you can, as soon as you realize that you have a problem, or not even wait until you have a problem. And what should you be eating? Whether you have menopause, whether you have painful periods, whether you have polycystic ovary syndrome, whether you have male genital organs, doesn't matter. You want to eat plants because it reduces insulin resistance. It causes sustained weight loss. It lowers inflammatory markers. So it's an anti-inflammatory way of eating. It reduces advanced glycation end products. It reduces oxidative stress. It reduces circulating androgen levels that are in excess, improves your cholesterol levels and your triglyceride levels. And it also improves your gut bacteria, because gut dysbiosis is a big issue for most chronic illnesses.
You spell fiber differently than us.
Oh, how do you say it?
We spell it F-I-B-E-R.
Oh, yes, we say R-E. Well, we are British, so British people have really weird spelling. Some of the spellings are tough.
And you say estrogen and we say estrogen.
Estrogen. You say a lot of different things. You actually say it as it's written, and English pronunciation tends to be so that it becomes quite difficult. It's more phonetic rather than, you say what you see. And that's actually a better way, I would say.
Yeah.
So what should you be eating? It's all very well to say eat whole plant foods. Well, remember that fruits are your friend. More fruits you eat, the lower is the risk of developing diabetes and chronic illnesses. So the sugar in the fruit is bound to the fiber. So try and remember that eating whole fruits is good, and depending on how many fruits you are already eating, try to increase and build on that. Vegetables, focus on all vegetables, especially dark leafy greens. Try and eat a lot of legumes, which are beans and peas and lentils and soy. Have minimally processed grains like quinoa and red rice and pinhead oats. Aim for at least 2 portions of soy and maybe 4, depending on your level of activity, or if you're in the menopause. I tend to have between 3 to 4 portions. So I have a cup of soy milk, a cup of soy yogurt, a handful of edamame beans and tofu most days. But it's important not to remember that this is part of a varied diet. You shouldn't be eating 30 portions of soy. That's not good for you. You want to be eating different foods, different fruits and vegetables and sweet potatoes and potatoes with skin. And actually, when you boil potatoes, try and keep them in the fridge. And Rohini actually taught me this. It increases the resistant starch. So you really want to be, maximizing anything that you put in your mouth. Think, how can I get the best effect for both for taste as well as for health? And that's a good way of looking at food, rather than, just eating it for the sake of eating it, because you should enjoy the food you eat. That's really important. And I'm a foodie. I go to sleep thinking about food. I wake up thinking about food. So, I love food. Nuts and seeds, really important. Walnuts, ground flax, and chia seeds. And try and make water your beverage of choice rather than having sodas. And keep salt, oil, and sugar really as flavorings rather than using large amounts of those. Yeah, next slide. We've talked a bit about soy, so I won't spend too much time, but just to say that it's safe. It's a complete plant protein, very similar to egg white. It has a lot of fiber, vitamins, minerals. Is high in polyunsaturated fatty acids, low in saturated fat. It helps you to have a slimmer waistline, great for polycystic ovaries, for reducing breast cancer, prostate cancer, colon cancer, liver cancer. And the isoflavones mimic estrogen and block its effect in others. That's how it works in reducing the risk of breast cancer. It does not behave like mammalian estrogen. So it's got this unique properties, but it's not just soy. Isoflavones are present in a large number of foods, but soy is just one of the richest sources. That's it. Yeah. Soy isoflavones work on menopausal hot flushes, as I said, reduces breast cancer. Starting to eat soy early in childhood, a single portion of soy, a cup of soy milk, or some edamame beans can actually reduce one's future risk of breast cancer. It also helps with weight loss. It has no adverse effects on men. And I know there's always a lot of discussion as to organic and GMO produced. In the UK, we actually don't have any GM modified soy, and none of the soy. You shouldn't be worried about rainforests with soy, because all the rainforests that are being cut down for soy is being fed to animals, not to us. Okay, only 6% of the soy, and that comes almost always from non-GM sources. And if you want to afford organic, then that's fine. I'm not fussed too much about that. It just, in the UK, it's not an issue at all. increased soy intake actually reduces a 26% reduction in prostate cancer risk, because men are often scared of eating soy. So it's important to know there's no reason to be worried at all about that. Next slide. Always focus on color. This gives you a sort of idea of what I would eat in a day. Often have a green smoothie that I might take to work, not in such a beautiful glass, usually in a stainless steel flask. Often I would have porridge, or in the morning, I would have a full dinner prepared by my terrible cook husband, Rajiv. Lunch would often be baked potatoes with baked beans or a soup, kale salad. I know, Chef AJ, you love your kale, so yes.
I do. Those are beautiful photos. Is that your actual food?
Yes.
Wow. The thing I left, the one on the left, it looks like some kind of cauliflower bowl. Wow.
Yes, it's delicious. This bowl was actually made by my friend, my neighbor who lives across. She's an amazing cook, so she makes all this amazing stuff as well. So yeah. Next slide.
Okay.
And what food should we be avoiding? So sugar sweetened beverages, fruit juices generally, oils are not really your friend. So if you're going to use oils, think about why you're using it. There is some benefits of using extra virgin olive oil and avocado oil, but really you're better off eating the avocado and eating the olives, unless you're trying to put on weight or you're a child. In that sort of situation, you may want to use. And if you are using, my usual advice when I do my cooking classes, Chef AJ, what I tell them is that if you're using 3 tablespoons of oil for cooking, this time use 2 for a week, and then go to 1 tablespoon, and then go to half a tablespoon, and slowly reduce it over a month or so. And slowly you will realize that actually sauteing in water or apple juice, all these things, so many different ways you can make the same food taste just as delicious for half the calories. Yeah. So avoid ultra-processed vegan diets and try to eat whole food, plant-based foods. Okay, so when you're having the vegan pizza or the vegan cake, eat it mindfully as treats rather than just because you want to. This we've already talked about. So remember that breast cancer is increased in those carrying excess body weight because there are higher estrogen levels. Plant-based diets have the lowest levels of estrogen. Are you hearing how I'm changing my pronunciation? Soy reduces breast cancer risk, and postmenopausal breast cancer survivors on tamoxifen who ate the most soy had the lowest rates of breast cancer. 1 in 8 women in the US and 1 in 7 women in the UK will get a diagnosis of breast cancer in their lifetime. Try to have 1 or 2 tablespoons of flaxseed or lignan, milled flaxseed in your diet. Try to eat mushrooms because they cause disruption of the cancer cells. Green tea also reduces the risk of breast cancer. And avoiding alcohol and smoking, trying to focus on plant foods, maintaining a healthy body weight, but don't neglect sleep, don't neglect stress triggers, keep a social life, and make sure that you're avoiding too much of screen time. So this was actually taken, this is not my slide, and I can't remember where I saw it, but was it, oh, I can't remember.
Dr. Furman?
Yes, it's Dr. Furman, yes. So eat your G-bombs, greens, beans, onions, mushrooms, berries, and seeds. And to that, I would say turmeric, soy, flaxseed, green tea. These are important things that you can remember so that you just eat a nice, varied diet and bring all these things into your life. And it's really enjoyable as well. I think I may have finished. I don't know.
Oh, those are your dogs.
Yeah, these are my, this is my first dog, and this was my daughter when she just turned vegan when she was 9. That's her now. She lives in New York. Naina Rohini, who you've already interviewed, she's a plant-based nutritionist. Naina is a senior editor for Time magazine. Rajiv and myself. This is Kapu, who was abandoned in a small village near us, and Tipu, who was abandoned in Bosnia. So they're both 6 years of age now. And yeah, that's my journey.
They are beautiful.
More of the food I eat, tend to eat nuts and seeds and, generally enjoy a lot of food.
Wow.
To summarize, plant-based nutrition, base your diet around whole plant foods, try to bring in exercise at least half an hour a day and at least half an hour twice a week of doing some strength training. It helps to improve insulin sensitivity. Try to do some exercise outdoors, the natural light. You know, the Japanese have something called Shinrin Yoku, which is forest bathing. Try to have 7 to 9 hours of sleep. I am very short on sleep because, 35 years of disturbed sleep as an OBGYN, I'm sure I'll be paying the price. Stress management, identify your stress triggers and find ways, whether it's deep breathing, meeting with friends, psychotherapy, yoga, whatever you need to do, and avoid drugs, alcohol, and smoking.
That's a beautiful slide.
Yeah, this is the market in India close to my home, and basically you can see that there is no diet and there's no condition that does not benefit from eating more plants. The same diet that prevents hot flashes will also prevent cancer, will also prevent and manage PCOS, will also manage your heart disease, will also help to reduce your risk of endometriosis, and will also make you feel younger, both at heart and in your body. And it's a one diet that fits all. The same diet that prevents so many health conditions is a diet where you don't really need to count calories, but it also addresses climate change, reduces animal suffering, and of course now reduces pandemics as well. So it's really important that we think about the world that we're leaving behind for future generations. And so if you can adopt a diet that helps all of these things, why not? And that's us. Out on the 28th of April, lots of case histories, myth busting. We have a 21-day plan, lots of vegan plant-based recipes, hundreds and hundreds of references. And that's my daughter, Rohini, with who I wrote the book.
Beautiful. Yeah. And then people can watch that episode too, if they want. I'll put a link to it. Well, I never can do my own slides, but it's amazing that I was able to.
You were amazing. You are absolutely brilliant. Very clever.
Okay, so now let me just get back to the show. There we are. So people are still here. That was wonderful. Thank you so much.
You're welcome.
The pictures were beautiful. So other than getting your book, which I'm going to encourage everyone to do with the link that's been in the chat and in the show notes, is there any other way that we can support you or follow you? Instagram seems to be the place where you are most active.
Yes, I am active because, I do want to reach young people to try and help them make changes as early as possible. And no, I don't need any other support except just everybody's love and blessings. And that's all we need.
Oh, thank you so much. It was just wonderful getting to know you. And I can't wait to meet your husband next Thursday. Yes. To tease him about his cooking.
Yes, and hopefully we'll meet on the cruise next year because Absolutely. Sandy's been in touch.
Coming back in 2023. So
yeah, March,
we're going to actually be on the show on July 11th to let people know that.
Fabulous.
Absolutely.
I'm so honored, Chef AJ. I cannot tell you, I have loved this so much. Really enjoyed it.
You got to tell me, what is the secret to your beautiful teeth?
Oh, in India, in medical school, it was a real problem having these teeth. When I was 18, there was something called ragging. I don't know if you know what ragging is. Basically, you would have your senior university students actually teasing the younger, the freshers. And so people would say, why do you have so many teeth? Most people have 32 teeth. How many teeth do you have? And so I had to always say I had 52 teeth. And they would make me count in public. It was so embarrassing. I used to hate my teeth. And so I'm really happy that somebody's saying.
Oh my God, I think they're stunning. And everybody else, the thread is, she has beautiful teeth. She has a beautiful smile. They're so white, they're perfect. These people are crazy. That is so ridiculous. I don't get people, man. Thankfully you've kept them all.
I have kept them all. And, I just turned 60 in February. And I
remember your birthday is Valentine's Day. I listened to your podcasts.
Yes. And I don't know where the last 30 years have gone. The last time I looked, I was 30 years of age and suddenly I'm 60, but I don't feel it. I feel about 20, so it's fine.
It really sneaks up on you. One last question that just came in the chat from Allie. Do you have any recommendations for dry skin during perimenopause?
Dry skin where? Just on the body? Then coconut oil. So instead of eating the oil, I recommend that you get some coconut oil, which you can keep in your bathroom. And after a shower, just take some on your hand. It's solid in the winter. And then when you rub it on your hands, it gets liquid, and you can use it to take off any makeup. You can put it all on your skin. You can put it on the vulval area. It really is a very, very good way of keeping your skin supple. If you don't like coconut oil or you don't like the smell, almond oil, vitamin E oil, those are really good. The other important thing to reduce dryness is make sure that you stay away from soaps and perfume toiletries and all the nasty chemicals, because they are no good for you. You know, your vagina is a self-cleaning oven, so is your skin.
You say vitamin, we say vitamin.
Yes, true.
That's great. Well, thank you so much.
Tomato.
Thank you so much, Dr. Bajekal. I really appreciate your presentation.
Neither do you, Chef.
Yeah.
Okay.
And thanks all of you for watching another episode of Chef AJ Live. Please come back tomorrow when my guest is preventative cardiologist, also plant-based, Dr. Nicole